Welcome, friends, and thank you for tuning in once again to the Optimal Health Program. Hope you're all doing well as we try to do to bring some great news articles and information to the forefront, show you what's out there, show you what research says, show you what your body's doing to help to maximize your health. Today, I wanted to talk about a specific topic, and we can kind of go in a variety of ways with that. It's one of the most common presentations to the doctor's office, and it's fatigue. Overwhelmingly, there are so many people that have varied levels of fatigue. Some are mild, some are severe. Some are hanging out in between in wax and wane. But, of course, people that come to the doctor's office are not feeling well, so they typically talk about the aches and pains they have, an infection they have. But this underlying fatigue current seems to be there in most people, and this is what I've seen over all the years that I've been practice. So we try to look for the underlying mechanism, the causes, and fix that. And if you could take someone who has a variety of things and change that fatigue, and now they have better energy, focus, concentration, mood, they can get out and do the exercise, which will further enhance their energy and flood oxygen to their tissues. You can take someone from in a really bad place and put them directly back to where they should be. So this morning, as I sat there at my kitchen table with my dogs on either side of my chair, guarding me from who knows what, I just ran through in my head the most common causes of fatigue and wrote down a couple of notes on my 3 pages of yellow pad paper. And one of the more common things we see, and again, it does depend upon age, does depend upon sex or gender. Younger women may have fatigue that's more correlated with iron deficiency because when they have their period every month and they lose blood, they're going to lose iron. So that's common in that segment. The older population is going to have multiple hormone deficiency, thyroid, DHEA, testosterone, estrogen, progesterone, IGF-1. So we have to look at this in context. But anemia is extremely common, in part because people don't get much iron in their diet, and their doctors aren't testing for the iron profile to see if they're anemic or if they're iron deficient. B12 plays a significant role in anemia. And the other part of the B12 problem is that a lot of people don't convert B12 from regular methyl hydroxy or cyanocobalamin into methyl B12 for it to be able to work. It has to be methyl B12 to work in your cells. You could have high B12 in your blood, and if you don't convert or methylate, it's not going to get into your cells to create that benefit or the energy. So not only do we look at B12 and iron and all the vitamins, because all the vitamins, when they're deficient, will create the issues with fatigue, but we look to see how well people will convert. And if they don't convert, we typically will give them and teach them how to give themselves methyl B12 shots. So methyl B12 in a little sub-Q injection can make you feel really good. And those people who don't convert genetically, who've never converted, once you get good methyl B12 levels on board, they feel really good. So important to talk about that. Very common virus. So viral causes of fatigue are up there, battling for first and second place. And the younger population has the highest association with viruses like Epstein-Barr, CMV, herpes viruses. And of course, this happens at all ages, but the literature describes that 90% of people in the world, the whole world, not just the U.S., have been exposed to Epstein-Barr virus between kindergarten and college. The first time you're exposed, it hits you hard. Your body has no soldiers to recognize it or to fight it. So you're tired, achy, irritable, flu-like. Some people have swollen spleen or swollen glands, sore throat, kissing tonsils. So the virus can be pretty rough on your body. There are bad connections to that virus if it's there for a long time. And there's an overwhelming amount of literature on Epstein-Barr correlated with 24 cancers, MS, lupus, autoimmune disorders. So it's not a good bug to have there for an extended period of time. That's why we talk about looking for it and trying to knock it down or knock it out with the vitamin C IVs. So hepatitis viruses, I mentioned herpes viruses, rhinoretroviruses, there are so many of them, but you have to look at these things to see what's there. A lot of doctors will do the wrong test for Epstein-Barr. They'll do a 1 antibody test. So there are 4 different antibodies for Epstein-Barr. One of them is IgG. If that is positive, it typically means that you've had prior exposure if the others are negative. Any combination of the early and the nuclear antigens and the IgG and certainly the IgM, if any of those are positive, 3 of them at a time, then your body has a reactivation of that virus, so it's there. If a person has IgM antibody positive, that's the acute recent antibody. That means that it's there. So we have to look at these tests and understand that they have to be done in the correct way and not use a smaller version of the test, which is not going to give you enough information. Other common correlations with fatigue, of course, are hormone decline, and this can happen in all ages. You don't really see this in teens, but there are cases that I've seen where young women and men, 18, 19, 20, have low thyroid, low T3, and it may be something correlated in their family. Their family members all had low thyroid when they were growing up. So correcting thyroid, DHEA, testosterone, IGF-1, which is the active component of growth hormone, estrogen, progesterone, will get your body back to where you were when you had good levels of these things and your body was functioning very well. So we have to look at not only your age and what's expected, but we have to put you to a level that will give you better function, which is usually a few years younger than your age on that blood test. Any comments or calls, Frankie?
We actually do. And if this person didn't watch last week's episode, watch this on LFA tomorrow. But they're asking, I had Lyme disease 2 years ago and still feel drained all the time. Is this normal or not?
So there's a lot to say about this. And, of course, last week's episode, Monday, we're going to play tomorrow, full episode. You'll have the entire thing there. It was such a great interview with Dr. Joseph Burrascano, who is the best Lyme doctor I've ever seen and met and learned from. We do a lot of the protocols that he had put together based upon all of his knowledge and research. So there's so many things to say. So if you were treated with a short course of antibiotics for Lyme based upon a positive test or based upon clinical picture, number one, that may not be long enough to kill that bug. So number two, as Dr. Burrascano said clearly, the big labs that draw blood for all sorts of things are still using the initial strain of Lyme, Borrelia burgdorferi, and are relying on that to tell you whether you do or don't have it. But there are many strains of Lyme that are not tested by the regular labs. So you could have other strains of Lyme and either be negative or borderline for the original strain. There are a dozen cofactor viruses that could be there. And my comment, and as we spoke about with Dr. Burrascano, Lyme really doesn't travel alone. There are other things that will come along with it. So we have to look at Ehrlichia, Babesia, Anaplasma, Bartonella-like organisms. We have to see how much of your immune system is affected because Lyme can inhibit your body's immune response. The CD57 blood test will tell us if your immune cells or your killer cells are hampered by that. And there are people that have fatigue, also from anemia, also from viruses and the things we're talking about. So some of that may be playing a role, but we have to be really comprehensive in the way that we test this. So the best mechanism of testing is to get your blood and send it out to IGeneX lab for the immunoblot tests for the different strains of Lyme and for the cofactors. Only there will you have that bigger picture that you may need to have. I don't know who did your testing and where it was done and who did the recommendations, but from just about every patient I've seen that's had Lyme over many, many years, we see that the testing is just not great. It's not super thorough testing like Dr. Burrascano has always recommended when he created his protocols. I mean, there's nothing better than what he's put together for us. So I think that's important. Certainly if you're local, you could call the office, come into the office. We could do a telehealth visit over the phone and try to get this information together so we could really see why you're still not feeling good. You know, initially when people were diagnosed with that early one strain of Lyme, which is the first one we found out about, people were given a week or two of antibiotic. They might have felt a little better at the time, but it never killed the bug with a week or two of antibiotic. And this is what we found out afterwards, because those people that were treated that way initially relapsed 3, 4, 6 months later. There are people who have Lyme that don't get the rash. Maybe 20 or 30% of people get the bullseye rash. Sometimes they get a rash that doesn't look like a bullseye, and people don't correlate it with Lyme. And some people take an antibiotic for a sore throat or a sinus issue that they've had, even though they have Lyme, and the week of antibiotic is not enough, and it comes back stronger down the road. So there's so many variables here, which I think we need to discuss in your case, but we certainly would love to help you out. If you like, you can give us a call at the Garden City office, 516-794-0404. Take a look at the website, drcalapai.com. It's got to be a thorough conversation.
Yeah, we have another one here. I feel okay in the morning, but by 2 p.m., I can barely think straight.
Okay.
Do you think this is blood sugar, stress?
So, a good doctor's got to wear a lot of hats. It's got to be a detective, a researcher, a coach, blah, blah, blah. So in many cases, when people feel okay and then they start to feel bad, an hour or two after lunch, sometimes you're reacting to what you had for lunch. If you have a lot of carb for lunch, pizza, pasta, bread, sandwiches, whatever, even fruit in some people, you're going to have your blood sugar go up. You're going to secrete extra insulin. Your blood sugar drops and you're tired. You're hypoglycemic. You may feel tired, achy, irritable, anxious. So that's a very common mechanism. Some people that have hormone decline like thyroid, DHEA, testosterone, etc., sometimes your levels are decent when you wake up in the morning because that's when you make your hormones. And then in the afternoon, that production just drops down and you're kind of sitting there with hormone decline, which, of course, we would test for in your blood, just like we would test for your blood sugar levels and maybe even do a glucose tolerance test to see if you are reactively hypoglycemic. So it depends upon your vitamin levels. Some people exercise first thing in the morning. They take their vitamins, they exercise, they're burning up the vitamins, and then by the afternoon time comes along, if you're mentally and physically active, your vitamins are low. So, again, women, certainly more so around the time they have their period, are going to be tired because they're decreasing their iron maintenance, and then for a lot of women, we'll have them take the iron every day, but then take 2 or 3 a day right before they have their period, so their levels are higher, and when they lose that blood of the iron, they're not deficient. So there are a lot of causes.
And just to follow up, is it the blood test that lets you know if the fatigue is coming from something physical or if it's tied to stress, depression, or burnout?
Yes, so great question. Depression, anxiety, of course, correlate very, very well with hormone decline. So we have to look at that. The physiologic burnout could be low magnesium, potassium, maybe not enough protein in the diet. I mean, it could be low B vitamin. It could be anything. So the blood test will give us answers to just about every part of that picture. Now, I would never discount that you could be anxious or depressed or irritable because, you have a reason for that may not be biologic. Your dog or cat died or something like that. Of course, they would tend to make you feel anxious, irritable, depressed, and such. But we have to look at all the underlying causes. And we do so, you start to create that repair, then your body will do extremely well.
We have, I feel like sometimes I feel like people are listening to me, but it's my first day off of coffee, okay? But said, hey, Doc, I live on coffee to get through the day. Could that be making my fatigue worse over time without me realizing it?
The word training your body, we can use in a couple of different circumstances. If you're training your body to live on a lot of caffeine, then whatever is causing your fatigue is not being corrected because you're putting that caffeine, that little bit of a drug on board to make yourself feel better. So if it is one of the other causes, low thyroid, DHEA, testosterone, female hormones, etc., low B vitamins, not converting the B12 to get the energy from the methyl B12, eating too much carb and causing blood sugar to drop from insulin, whatever the causes are, if we find the causes and fix that, you may not need to rely on the coffee all the time to get that energy or better function. Also, over time, we lose the ability to make NAD, nicotine adenine dinucleotide, which is a really important peptide that allows oxygen to go and produce 36 molecules of ATP, which is pure energy. So we need to understand where we are with this realm. And again, more of these things occur over time as people get a little bit older, past their 20s, 30s, 40s, et cetera. So we have to look at the entire picture. The other comment, too, that people don't realize until I explain it to them is that most people with the Western diet, the Americanized diet, eat a ton of carb. And you're training your body to make extra insulin whenever you eat the bagels for breakfast or the pancakes or the sandwich or the pizza, blah, blah, blah. All the high-carb meals, breakfast, lunch, and dinner. So your body's dumping a lot of insulin. As you get older and you might eat a little bit of carb, you're ready to dump a lot of insulin because you trained your body to do that. So big carb meals make more insulin. But after a while, since your body's always dumping the insulin, a little bit of carb, and you dump it, your sugar's low, and you start to feel tired or anxious, irritable, and panicky. After a while, and your pancreas gets tired of making that extra insulin, and your sugar starts to creep up, you can become diabetic, and that can have its own circumstance with fatigue as well. So your blood test will tell us.
Yeah, we have this other question just saying that I have really bad seasonal allergies, and I feel like when they get really bad, I'm very groggy and tired. Is there any correlation between allergies?
Absolutely, positively. So there's a pretty big cascade of events, substances that start to react once the allergy mechanism is engaged, whether it's allergy touching your eyes, pollens and such, or any irritant. You have 50 million mast cells on your eyeball that these things can pop up and hit, and then all of a sudden, your eyes start to tear. You have this chemical reaction. When you're breathing in things that you're allergic to and they hit the lining of your nose, just like tiny little particles, and you can see the particles on the cars now. You can see the green dust all over the cars. That hits your nose, that creates a reaction. If it gets further into your lungs and your bronchi, then your lungs become involved. You try to cough and sneeze and get these things out. If it's a food that you're eating, it gets into your bloodstream through your gut. Antibodies bind, and that can affect you in any area or part of your body. So absolutely, just like a sinus infection can cause that swelling and discomfort, allergy can do the same thing and make you feel foggy and tired and you can't think straight. So for the people that have the allergy mechanism, we can test for that specifically and see where your body has a threshold of reaction to different allergens. Because if you do a skin test and we see where your body first starts to react to an allergen, which we call the threshold, we can give you a treatment, whether it's drops under your tongue or a weekly injection, with a dose that's below your ability to be provoked by the allergen. Your body gets used to it. And if we gently raise that dose of what we're giving you, but stays below the threshold, your body gets used to it, your threshold goes up, then the allergy mechanism changes. That's the best way to work with the inhalant or environmental allergens. With foods, you're best just taking them out of your diet. And there are a lot of people that have food allergy that don't realize it, but if you eat something today, it doesn't have to give you a reaction within seconds. That's immediate, allergy reaction, but that's a smaller percentage of the total. Most allergy takes time, and it could be hours, days, or a week or so before the antibodies build up to hit that threshold and provoke your body. So you have to take all that into consideration.
And then a follow-up for that said, are there pregnancy-safe allergy medicines, or should I just stay away from them if I'm trying to conceive?
I think it's best to stay away from all medications if you're trying to conceive. There's some people that take quercetin, which has some antihistamine-like effect. And it's a natural occurring substance. It's a vitamin. So you could use quercetin. Some people use a little bit of vitamin C. So that may be one of the better ways to decrease your symptoms. And as well, if you were to test, if we did the blood test on you and we found you're allergic to certain foods, you take those foods out, that'll cut back the food component that's contributing to your symptoms. If you use HEPA filter air purifiers in your home or at work, wherever you're spending the majority of your time, that will trap the particles into those filters that are 0.3 microns and larger because they're just thick wadded filters, and you're taking them away from, provoking you. Getting rid of rugs, throw rugs, and wall-to-wall rugs and carpet, steam cleaning them with those cleaning devices would help because you're just grabbing all that stuff and getting it away from your personal environment.
Another follow-up, they said, are B12 shots and vitamin D safe for pregnancy as well?
Absolutely. Your body always requires B12 because it's water-soluble, it's not stored, so you need to have that B12 in good levels for many, many things in your body. Vitamin D is oil-based, so if your levels are low, we'll give a vitamin D shot to get you back up to the normal range, and we want to get you to between 80 and 100 on the B12 on the D levels. So B12, you want to be close to the 2,000 range, sometimes above that. But there are ways to test you, make the recommendation, and then retest to prove you're in the perfect range. That's why this whole mechanism of doing the vitamin packs that I've discussed will allow us to look at your blood test, understand your condition fully, and then I take a little pink sheet. Of course, every different sheet that we use in the office has a different color. And I'll check off the vitamins to take and put into the pack for your morning dose and check off the things to put into your evening dose. And all you have is a morning pack and an evening pack. And no headaches. You don't have to go out and buy 10 or 15 different bottles of things, and it's perfectly tailored to you. If you're asthmatic and your magnesium's low, we'll add more magnesium morning and evening. People with heart issues, we may add more CoQ10 morning and evening. Indigestion, stomach problems, cholesterol, I could tailor the vitamins in the pack specifically to your need. So you can't get a better custom recommendation for vitamins in that fashion. And you hear about people saying, take this, take that, but there's no customization because they're not learning about you, understanding your medical condition as I would, and certainly they're not looking at the blood test. So that's the best way to correct.
And then we have it. I've noticed if I do too much one day, I crash for 2 after. Is that something related to chronic fatigue syndrome or post-viral illness? What do you think?
Good question. It could be a variety of things. Now, most of the chronic fatigue mechanism is rooted in viral issues like Epstein-Barr virus. So if that virus is there, your immune system is weak. You try to do activity, you can't, you're exhausted. And I talk about the layering effect, almost like the layers of an onion. You start to keep peeling back, you really get to the underlying cause. So let's say you have fatigue, and your blood test tells us you have Epstein-Barr virus. Why is it there? Because your immune cells and your immune system can't kill it. Why so? Well, maybe your vitamins are low. Why are your vitamins low? Either you're not absorbing, and you're taking vitamins, or you're not taking the vitamins, and that's why you have this dysfunction. And then we know vitamin C, and using that intravenously quadruples your killer cells. So you're layering back to finding out all the causes, not just one thing, and trying to fix one thing. So if you're tired, and we say, look, you're anemic, your B12 and your iron are low, and you don't convert the B12. We know, okay, we have to get you the B12, the converted form, methyl B12. We have to get you some iron. And if your digestive system is not working well, we have to fix that. So these are the real causes, not just one comment on a blood test,
And just a follow-up says, my fatigue isn't just tiredness. It's like my brain and body are stuck in low gear.
All right, so the question would be to make this a little bit easier for me to answer more thoroughly is, how old is the person? Is it a man or a woman? So a person in their 40s will have different reasons than someone in their 20s, and in their 50s would have more hormone decline. So when your brain is that stuck and you just can't get out of gear, yes, allergy can play a role, but a person's going to say, I feel horrible in the spring. When the allergies hit, my brain's just not working. Well, I have brain fog. But people that have it year-round, maybe they don't have enough NAD, maybe the IGF-1 level, the active component of growth hormone, has dropped. That's great for memory, focus, concentration, mood, sleep, hair, skin, nails, fat burning, endurance, strength with exercise. So there are a lot of things that could correlate with that.
All right. She's 61, woman.
I'd be willing to guarantee that your IGF-1 levels are low because nobody has good IGF-1 levels in the 60s, that your thyroid is lower than it was in the past 2, 3, or 4 decades. So even though that thyroid might be at the borderline, you may need to have that up in the middle of the range. And while I'm talking about thyroid, traditionally doctors only look at 2 things, T4 and TSH. If your T4 and TSH are good, they say you're fine, but you may have a low T3. We always look at T3. I look at a bunch of things for thyroid, T3, T4, T3, T4 uptake, free T3, free T4, reverse T3, TSH, thyroid antibodies. So I'm looking at way more things, and honestly, we find are there things wrong with the thyroid, then we can correct that. So it's the more thorough nature of the blood test that I do that allows us to understand that.
So another 58 female says, I just found out that what they're calling a dangerously low B12 level. Honestly, it freaked me out. I've been having numbness in my feet for a while now and some memory problems like forgetting names. losing my train of thought mid-sentence. I'm worried this might have been going on for years and I didn't catch it in time.
It would be odd for the B12 to be that low to do all of that. It's possible. But, asking questions and trying to figure out and understand and looking at the blood testing and looking at your thyroid, DHEA, female hormones, looking at Epstein-Barr virus, IGF-1, looking at heavy metals, which I didn't get to because I only got part of the way down the first, part of the yellow page. Heavy metals can deplete vitamins and minerals and interfere with how they bind to receptors. You have to look at that. That's a major contributor. So there are a lot of different things that could do it. If your blood test says you're low on B12, when we give you a B12 shot and within a day you feel good or better, well, yeah, of course, that makes sense. I don't know whether or not you don't convert. We'd have to look to see what your conversion ability is with the methyl test. MTHFR is the name of the gene and gene test and the enzyme that convert B12. But we have to look at all these other things. Certainly in the 50s, the hormones are going to be low, vitamins are going to be low. NAD is not going to be working its best to be able to get your result there. So it's usually a combination of things at that point.
All right, we're good. You can continue through the article. You've answered all the questions thus far.
Excellent. So we need some more questions. So let's cut through. We spoke about NAD, decreasing the ability to convert oxygen to ATP. Diet, low carb. We spoke about high carb, creating insulin and low blood sugar. And junk foods. Too many people have junk foods. There's an article here from the other day that said 70% of the foods that people buy are ultra-processed foods, which is horrible. And there was a graph showing which foods are the most processed, some of the oils, of course. And the best would be your extra virgin olive oils because that's your best oil. Fish oil is very good for you, too. But buying stuff in the supermarket, look to see what's in it. And sometimes there's 5 or 6 different oils, and you're not getting a lot of olive oil in that type of olive oil. Alcohol depletes vitamins and minerals, inhibits hormone function. Insomnia, some people don't sleep well. That could be in part because as you get older, your hormones are declining, and you need those hormones for sleep. For men, we give them some progesterone at night to help with sleep because that's what it does. Men need a little bit of it. Women need more, obviously. You have the estrogen, progesterone. Men with low testosterone have difficulty sleeping. And same with IGF-1, because IGF-1 is a major contributor to repairing your brain cells' production of neurotransmitters. So just about everybody, when we correct their IGF-1, they've got some great sleep value.
Just a question regarding the olive oil. Just said, I keep hearing olive oil is good for you and your heart. What exactly does it do? Is it lower cholesterol? What is the deal?
Olive oil is a great source of fat for your body, and you need fat to make your hormones. So if you can get pure extra virgin olive oil and something that tastes good, I tell people to take a tablespoon once a day, first thing in the morning, last thing at night before you go to bed, because it's great for your body to help to prevent free radical damage. It can kill bacteria in your stomach. There's literature on it helping to kill Helicobacter. So your body needs proteins, fats, small amounts of carbohydrates, and the fats really should be your best sources of fat, like olive oil or fish oil. Avocado oil is good too, but I wouldn't use the other oils like the seed oils.
And then just a follow-up. A friend of mine said that it's really good for you, but someone also said that I shouldn't heat it up. Does cooking it ruin the health benefits?
You're not going to burn olive oil, like boil it in a pot, And there are different types of olive oil, and there's also MCT oil, which is medium-chain triglyceride oil, which you can use for cooking, and it's not affected by the cooking. But a lot of people for thousands of years have cooked with olive oil. There's really no negative issue with that. So most people should heat up food and not really char it and, burn it to death.
I was actually thinking about this question too, but someone asked, is extra virgin preferred, or is there any one that's better than the other?
Extra virgin, cold pressed usually are the best sources of olive oil. So being Italian, you always try to figure out where your best olive oil comes from. And of course, I'm half Sicilian, so Sicily is a great source. And there are places in Spain and places in Africa and Greece that make great olive oil. The reason I say this is because for many years I would go into the city and there's a restaurant called Fig and Olive. It's in meatpacking. It's also right in the 60s near Bloomingdale's. And their sort of shtick is that they offer you all these different appetizers, and you can get 5 appetizers and another 5. You could just keep getting appetizers and make that your whole meal, and it's amazing food. And you can get entrees too. But they end up having about 20 different types of olive oil from different places throughout the world. And the Sicilian olive oil, I think, is delicious. And one of them is called Bono, B-O-N-O. That's what my mom uses. That's what I have. It's really, really good tasting olive oil. Pure, excellent. Another one that a lot of the restaurants use is also Sicilian, called Partana, P-A-R-T-A-N-N-A. Really a very good olive oil. In Spain, their best olive oil is called Hojiblanca, Hogiblanca. In Portugal, their best olive oil is called Picual, P-I-C-U-A-L. It's a black label with, I think, gold letters on it. For the moment, I can't remember the name of the Greek olive oil that's really good that I have in the kitchen. But they're all good. And whenever I would go to eat there, I would buy a few different bottles and taste them and try them and this. And then there's olive oil with truffle in it, and But you could look those olive oils up and get them and taste them. Buy through 4 or 5 different ones and see which one you like the best. They're all good.
My Greek friends, they're like, yeah, we gave you the olive oil, you Italians. I'm like, yeah, but we mastered it, all right? So
Yes.
You're welcome. I don't know.
2 pretty prolific backgrounds, Italians and Greeks, when you talk about food and art and construction and architecture and math and, pretty amazing stuff. But that's, it's just wonderful food there. You can't go there and have bad food. You just can't.
You make me want to go back to Italy like way too often.
I know. I'm due. I think I'm going to do it in October.
Oh, good for you.
Do a little bit of a
You
run.
deserve
a week and a half.
All right.
Maybe 2 weeks. Depending. Let's see. Inactivity can make you tired because you need the activity to flood oxygen that you're breathing in to get delivered to all of your cells and deliver your vitamins, minerals, and hormones. This is a very simple thing, an obvious thing, but no one really thinks about it. Think about having 100 trillion cells in your body and then flooding all your blood flow to deliver all this great stuff. There are some people who do too much activity and are depleting their vitamins, and we pick that up on the blood test. Not often, but you see it in people that do too much running or too much cycling. Those people need to have vitamin intake that's up here, because then when they burn through that, at least they're going to stay at a good range and they're not becoming depleted. But inactivity will decrease delivery of all those good things to all of your cells. We've spoken about Lyme disease as a major contributor to fatigue. They have called Lyme disease the great masquerader, as they called syphilis back at the turn of the century, because people have all these weird things, and unless you know how to test for it, you won't be able to pick it up correctly. And I've told patients, as I did on the show with Dr. Burscano, I've had patients that 4 or 5 times tested via the big blood labs that only look at that original strain are negative. And then we test them more thoroughly, and we find that it's there. So important to know how to test for it. Allergy, we spoke about histamine surge, causing fatigue. Antihistamines are a common cause of fatigue. That's why they've made non-sedating antihistamines. Prototypically, Benadryl, which are given to kids, and adults use it, decreases some of the allergy cascade, but it makes you tired. For some parents, they like that because they make the kid tired and the kid falls asleep. But,
I don't like it when I have a walnut on accident and I'm like, all right, now I guess I got to go to sleep. I got to take 3 of these things.
Yep.
All right, we're back to olive oil, but
Okay.
what's the best way to start incorporating them into my meals without overdoing it? Well, you're not Italian, because if you're Italian, you're overdoing it.
Yeah.
And it's a good thing.
You can put it obviously on your salad. You can put it on any kind of food. People put it on different proteins that they eat. People put it on their vegetables, so you can put it anywhere. And again, I take a tablespoon of it either late at night or first thing in the morning. Let it sit in my gut.
I've had gelato with it on,
Yeah. I've had gelato with balsamic.
Yeah.
And I thought that's pretty odd, but
It works.
it does. And a lot of the good restaurants now, when you go out for either fish or any of the proteins or steak or, pork chops, They'll either have the olive oil on the table, and you can put it on your food, and they may cook with it. So I think it's great for you all the way around. If the only oil you could have for the rest of your life would be olive oil, you'd be in great shape.
And I feel like when I was younger, it was like, oh no, the olive oil, like don't have too much. I mean, like I just feel like since it, back in the day, it was like, oh, the salt is bad, this is bad, that is bad, and it's like
there's been a big campaign against fat and protein for many, many years. They were talking about how bad eggs were because of the cholesterol. Then you look at literature now that's completely turned that upside down. You look at people that follow the Atkins diet, had lots of eggs, had lots of protein and steak and chops and whatever, and got rid of all the carbs. They lost a lot of weight, burned through all of their cholesterol, burned the fat like crazy, which is wonderful for your body. So much so that there are more low-carb diets now and than ever before, and there are no high-carb diets because of all that sugar creating all the bad issues. So there are people that say that we're meant to eat proteins because all the good things we get from the protein, including the B vitamins, etc. But I like to have vitamins on board to make sure you have more than enough, and that you're not going to get that much from salad. I mean, the roughage part is good, but you want to have things that make your body healthy and strong. And so for years, there's been this attack on the fats and the cholesterol and the protein, and still there's the attack on the cholesterol, even though we know we need it for brain function. And now they're saying, and have been, that the medications that lower cholesterol, besides wiping out CoQ10, can damage your brain function. So
someone's asking in Rumble, what kinds of fats are actually good for the heart?
Well, your olive oil is good for your heart. Fish oil is good for your heart. Avocado oil. These things are the most natural mechanisms and are more protective because they decrease the inflammatory mechanism. Fish oil decreases prostaglandins that can cause inflammation. And there's a pathway where ALA alpha linoleic acid, breaks down and can go towards an pro-inflammatory pathway, but fish oil blocks that and leads it to an anti-inflammatory pathway. That's how fish oil works. So that would make sense. Avocado oil is good. Some of the nut oils are good.
So someone's asking what your thoughts on coconut oil.
Coconut oil is good.
Okay.
Absolutely.
So someone else said, I'm trying to build muscle and cut carbs. Are healthy fats actually useful for energy and recovery, or just for
Yes.
satiety?
Healthy fats are always good. And healthy fats are good for stabilizing your hormones. They're a good source of calories. For people that want to burn down weight and fat, having fat doesn't make you fat. Having the carb blocks your body's ability to burn the fat. So cutting the carbs down allows your body to burn the fats. I'd rather have people be a good fat-burning machine with a lot of exercise, good proteins, good vegetables, etc., but keep the carbs down so you have the ability to burn the cholesterol and triglycerides right off the bat and keep the weight down.
So someone's asking, I've been eating fat-free everything for at least 20 years. Could that have been done damage to my hormones or metabolism?
To some extent, it's possible. I mean, I would love to be able to scientifically look at your blood work for 20 years just to see where, your hormones are and see, the decline there. I can tell you that I have tons of patients, many thousands of patients over 37 years, and the ones that typically follow the Mediterranean type diet are healthier. And again, the olive oil, fish oil, etc., good foods, no high carb, are healthier in many ways compared to those that either are doing too many carbs or who are eating the junk food.
And someone's asking about what's the deal between the omega-3 and the omega-6 fats. They said, I keep hearing that too much omega-6 is bad. Is this true?
Too much omega-6 can have slight pro-inflammatory components, but the omega-3s block that. There was a researcher in New Jersey over a few years that was trying to get blood testing done, which the insurance companies don't want to pay for, to look at omega-3 and 6 ratios. So although the literature said relatively clearly that you want to have more omega-3 and less omega-6, you don't really need a blood test to tell you that. You want to have those good omega-3s on board, and that's why we talk about people using the fish oil. And because it blocks that prostaglandin pathway, as I mentioned a few minutes ago.
So they're just asking, so you're saying if I add more healthy fat to my breakfast, it should help stabilize my energy? Question mark.
Well, I don't know what your energy issues are or whether everything else is good in your circumstance. So it's not a light switch where you have extra fats and healthy fats and all of a sudden things will change. You have to look at your vitamins, minerals, hormones, heavy metals, because all of these things can play a role that you won't realize behind the scenes. And it's not as though you can take one vitamin and correct every different area. Taking the vitamin corrects that vitamin issue. But it's not going to get rid of lead, mercury, cadmium, nickel, arsenic, or the metals. If you correct thyroid, that may be good, but it's not going to correct that B12 conversion issue. So you have to look to see what all of those things are and fix each step of the way.
Listen, the chat wants to talk about olive oil. I will allow it. All right.
Okay.
I've heard vegetable oils like canola. Yeah, canola no good. And soybean oils are bad for you. Should we be cutting those out completely?
I think it makes sense. I think you should just have the olive oil and the fish oil. I think if you want to have some avocado, that's great. Coconut oil is great. You can get nuts from, you can get oil from nuts. So, macadamia and a variety of those, they have nutrients in them as well. So there are better natural sources of fats and oils that you could have as opposed to the others.
All right. That's it for right now. And guys, just don't forget, we got a phone number. If you want to call, no one likes to call anymore, but we got a phone number, 888-420-9272. If you want to ask any questions, give us a call. We will put you live on air.
We'd love to chat with you. 888-420-9272 for people who want to contact the office. 516-794-0404. We can pop that up on the screen. Website, drcalapai.com, drcalapai.com. Look at some of the cool and new stuff we're doing. I had some very, very nice conversations with two companies that were working with a large nursing organization that goes to administer and take care of people at home. We're working with them. We're going to be doing telehealth with those individuals who can't get out and get to the office. And the reason why I thought about this and have been working on this for a while is that probably 75% of the patients that I see when we talk about this and that and we do the big blood test, no other doctors do that, they say they can't get appointments with their doctors because some of those doctors are bought out by these big organizations and all of a sudden you can't get a doctor's appointment for 3 or 4 months, which is insane. First of all, that's horrible for the patients, and I just don't get why things are moving that way. I think there's some sort of behind-the-scenes push to make doctor's visits sort of obsolete, to just get people in and out for 2 seconds and get them on a medication, which is great for the drug company, maybe not be great for the patient, but the old back and forth that you had with your favorite doctor, is sort of going by the wayside. So I think in the future, a lot of medicine and healthcare will be well-coordinated telemedicine. So I've been doing telemedicine for years now, but a mechanism of being able to have a telehealth visit over the phone with myself or my nurse prac or my staff PA, where we can take your evaluation and send a lab to your home to get the blood work that we want done. And then as that comes back within 5 days, review the blood work with you, start making recommendations for vitamins and dietary change and exercise, etc. This is a great way to connect with people. And we'll have the ability once or twice or even 3 times a month to do visits with patients so that they can have their questions answered. No more 3 or 4 months and they don't want to talk about allergy or don't want to talk about vitamins. We're going to have all of this available because this is what I've always done. So we'll be doing this. And to be able to monitor patients and connect with them more closely and work with their primary or their specialists is a genius idea. If your cholesterol starts to go out of whack and we can determine and step in and correct or fix, etc., same thing with your blood pressure, oxygenation, it's ideal. So this is what I've been working on diligently. So we have a couple of large groups that we're going to start doing this for. And as I have explained this to some of the patients, and primarily, Medicare age patients 65 and older, and those who can't get out of their home, we also may extend that to people that are non-Medicare and make the same offering. Why not? If we can correct things for you and you become healthier, and you will as a result of it, why not? I spoke about a few weeks ago doing a vitamin consult for people that can't get to the office because they're too far away in New York, outside New York. We can do the telehealth visit and get the lab to do the blood work and then just correct your vitamins. At the very least, we can do that for people. So we're going to make this available, and it's already happening. So we'll keep you abreast of it.
Yeah, we have someone saying, I've been calling around for months trying to get a pediatrician for my kids. It is impossible.
So I still don't understand that. It's not as though there are no more doctors around. The doctors are still around. Yeah, some retire, but new doctors come into practice. But are they being hired by these big organizations which are corralling patients and with the best insurance and pushing people away? I don't know. Doesn't make sense to me.
I passed my old pediatrician the other day, and it's now, NYU, Lango. It's like, oh, of course. Should have expected that.
So I have a terrific eye doctor, Dr. Burke, and he's on Stewart Avenue in Garden City. My dad, rest his soul, used to see him. No pun intended. Used to go to him. My mom sees another great ophthalmologist, and the appointments are there all the time, anytime. You may call today and not get in today, but a day or two later or whatever, a week. I was going to a place for my contacts, and a large ophthalmic business took over what was an amazing place, and you can't get in. You just can't get in. Who wants to wait month to month to month to get your eye exam and to get your pressure checked and to do all these things? So I don't know why this is happening, but I don't like it.
Yeah.
Nobody likes it.
Chat doesn't like it, that's for sure. Someone says, is this going to create a bigger problem, health problems down the road? I mean, people are just skipping basic checkups and screenings. It's ridiculous.
It's already creating a problem because, and I know patients, some of my patients who tried to get colonoscopies done because they're having stomach problems. I can't get to my doctor for 4 months. That's crazy. For a couple of them, I was able to make a call to a doctor that I know and said, look, they can't get to their guy, et cetera. Any chance you have an opening? And he was able to take them in. But I can't send 100 people to that doctor and say, here, fit them all in. Fortunately, I have a wonderful relationship with St. Francis Hospital, and my favorite cardiologist is Dr. Schlafmitz. He runs St. Francis and all the Catholic hospitals, cardiology divisions. And I've never seen a doctor who's worked as hard as he has. We'll love to get him on and do a podcast one day, but he works hours that are just unimaginable. And he's got a huge team of doctors and PAs and nurse pracs that work with him. And the interesting thing, and when I first started sending patients to him years ago, he has his cell phone around his neck. So when he's in the office and gets to the hospital 4:30, 5 o'clock in the morning, does rounds on people going for all sorts of cardiac surgeries, check everybody out, make sure everything's good, does rounds with the interns and the NPs and the PAs, go to the office, we'll set up, look at his schedule, then go to do catheterizations all morning, has a bite to eat for lunch, then we'll do hospital policy meetings, and then go do rounds again on all the patients that have had surgery, double checking on them, all the cath patients. Then we'll have a bite to eat. We'll do a few more meetings. He doesn't get out of there until like 10 o'clock at night. So I've never seen anybody work that much or that hard. But he's on point, and he's the best. And his group and team of all the doctors that are there working with him are the best. Dr. Mezzafonte, Dr. Friedman, Dr. Robinson. It's just a terrific group of doctors. So one of my favorite stories with him was a patient who came in to see me in my Plainview office a few years ago, and he had a really bad aortic valve. And you could hear how bad the valve was without even putting the stethoscope on his chest. I listened to him, checked him out, and I told the patient, I said, I'm just going to make a phone call to the cardiologist, and I want to see what his availability is. So I called, I said, Rich, this guy's bad. I mean, the valve is bad. You could hear it from across the room without the stethoscope. And he was having a hard time walking down the hall. Couldn't really go up and down stairs much. I said, this guy's got to be, done as quickly as you can do it. He goes, don't worry about it. Nonchalant, don't worry about it. We'll send up the ambulance. We'll get it done. I'll do it this afternoon. So that was like 9 a.m. They brought him back there, did whatever pre-op stuff they did. And by 12:30, 1 o'clock, he had a new valve. I was like, that's pretty cool. So it's just when everything is running perfectly, that's where you want to go.
Right. And a few people commented similarly to this, but just said, I've been pushed towards virtual visits or corporate clinics every which way. And I've had the same thing. It's like, you try to get anyone and it's like, okay, we'll do a Zoom call.
Right.
What the hell is what?
Yep. It's just, you got to be able to see your doctor. I mean, literally see them, have him examine you sometime. It may not need to be every time you have an issue, unless you have a really bad circumstance, heart or otherwise. But it's just way out there. You can't get to see them. So the ability to connect with patients, twice a month, 3 times a month, et cetera, and monitor them is brilliant because they're comfortable, they're happy, they have a question, they can call you, set them up, you do the visit. It just makes all the sense in the world. Phone lines are open, 888-420-9272. If you'd like to call and ask a question, you could do so now, 888-420-9272. Moving right along with our discussion of the vitamins of fatigue, heart failure, chronic infection correlates with fatigue. Irritable bowel disorders correlate with fatigue because you're not absorbing your vitamins well. Cholesterol drugs wiping out CoQ10 cause fatigue and aches and pains in your muscles and make your heart weak. The list goes on. Neurologic disorders, MS, Parkinson's, ALS, long list. Vascular disorders, you're not getting blood flow to carry things around. Sleep apnea contributes to fatigue because you're not getting good, deep REM sleep. So all of these things have to be evaluated when you really have that persistent fatigue issue. Any other questions?
Waiting on them. I guess
we'll give them a few minutes to get their questions.
I know it's Friday, guys, but come
on. Also, what to do for fatigue. I mean, it's kind of obvious that if your thyroid and your hormones are off, we correct them. And then within 2 to 3 weeks, recheck your blood to prove that that's the right dose. If we need to adjust, great. We adjust and recheck. As soon as you're on the right dose, you see your results. We've had patients come in with a thyroid level T3 of 40, and it's supposed to be at least 100. And then we start to correct that with the natural thyroid, retest the blood, and not only do they feel better, they look better, but their levels are in good range. Vitamin IVs are great for the infectious mechanism. Correcting oral vitamins, the B12, methyl B12 shot we've discussed. So depending upon what you're presenting with, we can correct that accordingly. And it may be 2 or 3 different things we need to correct because nothing says you could only have one cause of things. There are multiple causes of these things. The other comment, too, is that mindset is really important. So a lot of individuals, when they're tired and achy and they can't figure out what's going on, their doctors can't figure it out, they become, anxious, irritable, aggravated. Of course you would. I mean, who wouldn't? You can't figure out what's happening. But we like to work on the mindset as well because once we start to correct things, we want people to be strong and forward-thinking and focused. We want them to reinforce the positive mechanism of thought and do the exercise and walk their way through all of this. So we can't negate or neglect the importance of keeping your mind straight forward and focused. Some of that, as we've mentioned, is affected by nutrient deficiency or hormone deficiency or heavy metal exposure. But as once we start to correct that, all of a sudden your mindset starts to become strong. NAD is wonderful for your brain. IGF-1 is wonderful for your brain. So once these things are evaluated and on board, then your mindset becomes strong. couple of questions from patients through the email, and thank you so much for the emails. We have a lot of these. Hormone decline in bone strength. So your bones respond, obviously, to good hormone levels. For women, estrogen, progesterone, DHEA, thyroid hormone. Testosterone is great for bones in women. That's why we use a sublingual pellet for women. All your vitamins, calcium, magnesium, potassium, boron, all of these things. So bone strength and stability is a combination of correcting vitamins, minerals, hormones, and exercise. So all of them need to be put together to create the best outcome. A lot of people now, because the allergy season's going crazy, have a chronic cough. So in most cases, when you breathe things in, they come in through your nose. They hit your back of your nasal cavity. Your body wants to flush them out, postnasal drip. That could hit the back of your throat, create a cough. You want to push things out. It can create sneezing. You want to get things out of your body, but you want to look at the allergy mechanism specific to that. Interest in peptides. Well, peptides I think are wonderful. They're not drugs, but we have to have peptides that are created by compounding pharmacies so that they're pure. And IGF-1 is a peptide. The injectable once-a-week things that are used, the GLPs for weight loss, are peptides. NAD is a peptide. So I think they're wonderful things to use, but it's got to be based on testing.
Just one question here. Said, I've had a cough that won't go away for over 2 months. I don't feel sick at all anymore, but what else could be causing it? How do I end this
Could be allergy.
nonsense?
Could be inflammation that in part comes from allergy, in part from infection. So infections can linger. And there are people that'll have a chronic cough or a chronic sinus infection, even though the initial more severe symptoms have dissipated and they may have taken an antibiotic for something. In my realm, if a person's got an infection and you just take an antibiotic, the antibiotic's not changing you or fixing you or giving you something. It's helping to kill a bug, but once it's gone, there's nothing else there helping your body. That's why we typically will correct vitamins, do vitamin IVs, because then using the vitamin IVs, you're quadrupling your killer cells, you're inhibiting inflammation and free radical damage. So it's always a combination of things that works best, especially for chronic cough and chronic inflammation or infection. Also, there are people who pick up a bug that could be bacterial, and that usually is yellow, green, or brown mucus. But at the same time, you can pick up a virus. And some people have fungal issues. So if you treat the bacteria, but nothing's treating the virus, then you'll still have symptoms that remain. And some people with cough, they have reflux where their gut is irritated. When they lie down at night, some of the acid in their gut that's not staying there can track up and irritate the lining, even get up to the airways.
Okay. People are pretty chill in the chat.
That's all right. There's not a million things to ask about, but we appreciate it. We love it. All righty. So if you'd like to give us a call at the office, 516-794-0404. Website's drcalapai.com. Ask us about all the new and different things that we're doing. We're excited to do this. The vitamin packs, the telehealth appointments. And telehealth is available for everybody. We have people calling in from all over the country. And then we would send a prescription to them so they can get their local lab to do the blood work. If they're local, we can send a local lab to their home to get the blood work done. So we try to make it as easy for you as possible. But you want your body to be strong and healthy and better year to year, as opposed to allowing your body to lose ground and lose function. Thank you for listening today. God bless you all. Have an amazing day. Give us a call. We'd love to help you out. Bye-bye now. We'll be back here Saturday at 2:30. Great interview. You got to watch that one. Dr. Berscano.